Good morning, class. Today I did tetralogy of Fallet. So, what is tetralogy of Fallet? A congenital heart condition involves four abnormalities occurring together, including a defective septum between the ventricular and narrowing of the pulmonary artery and accompanied by cyanosis. It is called tetralogy of Fallet. Again, I am telling definition or introduction of tetralogy of Fallet. So, tetralogy of Fallet is a congenital heart defect involving four abnormalities occurring together, including a defective septum between the ventricle and narrowing of the pulmonary artery and accompanied by cyanosis. So, it is a tetralogy of Fallet. So, normal heart. In a normal heart has four chamber, two filling chamber, two pumping chamber, and vein drain blood into the heart and the artery carry blood away from heart. It is a normal mechanism of heart. It is present four chamber. So first two filling chamber, two pumping chamber, and their vein drain blood into the heart and artery carry blood away from heart. Red blood cells supply oxygen around the whole body, and blue, this is I can tell this pictures. So in this picture, red blood supply oxygen around the body and the blue blood is returned to the right side of the heart to lung for oxygenation. Oxygenated blood flow to the left side of the heart and pumped around the body. It is a mechanism of heart. Again I am telling and I am describe this picture of the heart. So red blood supply means in this red color indicated red blood supply oxygenated around the body, oxygenated blood around the body. Then blue blood is returned to the right side of the heart to lung for oxygenation, and oxygenated blood flow to the left side of the heart and pumped around the body. Chamber and vessels of heart separated by valve and a wall of muscles called septum, means it is divided between two parts of the heart. This is called septum. So in tetralogy of Fallet having four abnormalities, so we can study one by one. In first, pulmonary stenosis means there present four defect in tetralogy of Fallet. First is pulmonary stenosis, right ventricular hypertrophy. Second and third is ventricular septal defect. Fourth, overriding of aorta. So first is pulmonary stenosis. In pulmonary stenosis, narrowing of the pulmonary artery in the right ventricular. Pulmonary stenosis, narrowing of the pulmonary artery. You can see this image. This is a circle in pulmonary stenosis image, and normal heart they can is a normal phenomena of heart, and in pulmonary stenosis there is a narrowing of the pulmonary artery junction. So in pulmonary stenosis, narrowing of the pulmonary valve and main pulmonary artery. Then second is right ventricular hypertrophy. The size of the right ventricular increase due to pumping at a high pressure. Because of increase of volume or pressure, there is hypertrophied. The size of the right ventricular in which part? In a ventricular part. The size of the right ventricular increase due to pumping at high pressure. You can see in this picture right ventricular hypertrophy in a below structure of the heart. The muscular wall of the lower right chamber of the heart, it is thickened than normal. You can see in the muscular wall of the lower right chamber of the heart means right ventricular is thickened than their normal condition. That is called right ventricular hypertrophy. Next is ventricular septal defect. We can also study before ventricular septal defect. So, what is ventricular septal defect? There is a hole between the left and right ventricular due to which oxygenated and deoxygenated blood are mixed. So, ventricular septal defect means the defect is present between ventricular right to left ventricular and the hole is present in between. A hole in the wall between the two lower chamber or ventricular of the heart, that is called ventricular septal defect. You can see in this image. That is tetralogy of Fallot. Again I am telling. First is pulmonary stenosis, right ventricular hypertrophy, ventricular septal defect and overriding of a aorta. That is pulmonary stenosis, right ventricular hypertrophy and ventricular septal defect. And last is a overriding of aorta. In overriding of aorta, which the aortic wall which open to the aorta is enlarged and seems to open and the aortic wall which open to the aorta is enlarged and seems to open from both ventricular rather than from the left ventricle only, as in a normal heart. In this defect, the aortic wall side directly on top of the ventricular septal defect. That is overriding of aorta. You can see in this image, in overriding of aorta, the aorta wall which open to the aorta is enlarged and seem to open from both ventricular rather than from the left ventricular only, as in a normal heart. In this defect, that aortic wall sits directly on top of the ventricular septal defect. That is called overriding of aorta. You can see in this image. So, that is 4 main defects present in the tetralogy of Fallot. First is pulmonary stenosis, right ventricular hypertrophy, ventricular septal defect and overriding of aorta. Next is causes of ventricular septal causes of tetralogy of Fallot. First is chromosomal 22 deleted. If the chromosome 22 is deleted, so baby having tetralogy of Fallot, poor maternal nutrition during pregnancy. If mother is not taking proper nutrition, so this causes also contribute to TOF. Any maternal illness, if mother having during pregnancy chronic illness, so that condition also occur TOF. Then mother below 20 or above 35 year of age, so that is also contribute TOF. Then maternal addiction. In maternal addiction, the mother during pregnancy taking alcohol, some drugs and tobacco and some other drugs, that is all are contributing pathology of Fallot or congenital heart defects. Again I am telling, chromosome 22 deleted, poor maternal nutrition, any maternal illness, mother below 20 or above 35 of years, maternal addiction. Then synum symptom. So synum symptom, after feeding or crying or walking up after sleep, the baby suddenly develop blue skin, nail and lips. Means the baby after feeding or after walking or after sleeping, baby having cyanosis present in their skin, nails and their lips, and that is called tell spells. Children with the pathology of Fallot exhibit bluish skin during episodes of crying or feeding, that is called tell spell. Again I am telling, that is called tell spell. Bluish discoloration of the skin, like bluish skin, bluish nails and their lips, that is called tell spell. That is a main synum symptom of pathology of Fallot. So what causes behind spell? Due to spasm or contraction of a band of muscle in the right ventricular just under the pulmonary wall. This is a main cause of spell. When this muscle contract, it further narrow the channel of the blood flow into the lung. As a result, oxygen delivery become further reduced. This calls a spell. Means the oxygen delivery of tissues is less, so that is called spell or spasm. Next is treatment for spell. Knee chest position. We can give it the spell present after feeding, after crying or after sleeping of the baby. So we can give knee chest position to the baby to increase aortic resistance, that decrease aortic and left ventricular pressure, reduce the rush of the blood through the septal hole from the right ventricular and improve blood circulation to the lungs. Means oxygen. So we can treat spell, give knee chest position. Next synum symptom, clumping finger and nails. You can see in first image clumping finger, that is a abnormal nail bud structure. You can see normal angle of nail bud in first picture, and just below distort angle of nail bud, means prominent nail buds present of clumping finger and nail in pathology of Fallot baby, that is called clubbed finger. Then squatting position, slow weight gain, dyspnea or exertion. If baby excretion, the cyanosis present in their body. Then boot shoe heart on X-ray. Means if we can take X-ray, the heart show boot shoe like structure. Then next is investigation. So which type of investigation we can take in pathology of Fallot condition? First is chest X-ray. I am also telling boot shoe heart. It means apex is tilted up and there is a concavity in the region of pulmonary artery present of chest X-ray, like boot shoe heart. Then oligamic lungs filled hilar vessels are few lung vessels, also few large right ventricular. It's also seen in chest X-ray. Other diagnostic evolution means this is a chest X-ray is a main diagnostic evolution of tetralogy of Fallot. We can easily see in boot shoes heart structure. And next diagnostic evolution is electrocardiogram, chest X-ray, echocardiography and auscultation. So this four major diagnostic evolution we can in this type of diagnostic evolution we can help to diagnose tetralogy of Fallot. Next, management. In management, oxygen administration where there is a cyanosis. If baby having cyanosis after crying, after feeding or after sleeping, the oxygen administration we can give of the baby. Small and frequent meal to be given. We cannot give large amount of milk to the baby, because if we can give a large amount of milk, the baby having cyanosis after milk, so small and frequent meal to be given to the baby. During TEL spell we can give knee chest position or squatting position to increase blood flow to the lung. Then next is limit strenuous activity, reduce anxiety and stress to the child. Means we can limit the activity of the child, because the child having four type of heart defect. So if the baby is giving extra activities, so the baby having cyanosis or oxygen hunger in their body. So limit their activities and reduce anxiety and stress to the child. Next, we can give beta blockers such as propranolol. Acute episodes of TEL spell we can give. Many require rapid intervention with the morphine to reduce ventilatory drive and vasopressure such as epinephrine, phenylephrine or norepinephrine to increase blood pressure. Again I am telling the drug we can give in a TOF patient. Beta blockers such as propranolol. Acute episode may require rapid intervention with the morphine to reduce ventilatory drive and the vasopressor such as epinephrine, phenylephrine or norepinephrine to increase blood pressure. Next, the surgical intervention. So in temporary surgical intervention, firstly it is done when the child is neonate or an infant. In this, a temporary shunt is made between the right or left subclavicle artery and pulmonary artery. Firstly, in temporary surgical intervention, it is a temporary shunt is made between the right or left subclavicle artery and pulmonary artery. We can give blocked tushing shunt. Then next is tushing between ascending aorta and pulmonary artery is called western shunt. You can see is this image. First, tushing shunt. If this temporary shunt is made between the right or left subclavicle artery and pulmonary artery, means in between subclavicle artery and pulmonary artery. In tushing shunt, subclavicle and pulmonary artery we can put tushing shunt. And next in water shunt, we can put shunt between ascending aorta and pulmonary artery. In Watterson shunt, we can put, again I am telling, we can put between ascending aorta and pulmonary artery. So this is all temporarily shunt or temporary device. Next, total correction in permanent correction. In total correction, the hole in the ventricular septum is closed with a patch and the obstruction to right ventricular outflow. Pulmonic stenosis is open, and this correction allow blood flow to the lung for oxygenation before being pumped out into the body. Means in this correction, this is called total correction or permanent correction. So in this correction, the hole in the ventricular septal defect is closed with the patch and the obstruction to the right ventricular outflow. Pulmonic stenosis is open. So in this surgery, in this correction, allow flow to the lung for oxygenation before pump out into the body, and the blood is circulated all over body. This is total correction. I am also in surgical management, block tushing operation. I am also tell connection between the right subclavicle artery and the right pulmonary artery, which increase the amount of oxygenated blood reach to the lungs and relieve cyanosis. This is the main management of TOF. Again I am telling, connection between the right subclavicle artery and the right pulmonary artery, which increase the amount of oxygenated blood reaching the lungs, then relieve the cyanosis of the body. Then port shunt, descending aorta is anastomosed to the pulmonary artery, that is port shunt, that is port shunt. In port shunt, descending aorta is anastomosed to the pulmonary artery. Then Watterson shunt, ascending aorta, right pulmonary artery anastomosis. We can correct the TOF. This is a machine, heart lung machine, that is called heart lung machine. In between we can give open heart surgery or heart surgery. So this device help to the pumping of the heart. So this is a TOF management, TOF surgical management. Last is complication, untreated complication, delayed growth and development. In TOF patient, very delayed growth and their development, and we cannot treat. Then next is arrhythmia, seizure, stroke, pulmonary embolism, cardiac death sometime, and post-op infection, after surgery infection, conduction abnormalities, pulmonary valve regurgitation. That is all post-operative complication, means after procedure the infection and the conduction abnormality, pulmonary valve regurgitation also. This is a complication of post-operative. So this is a TOF management or TOF management and their complication. So before I am so we can give in next portion is summarize the topic. So in summarize in my topic, first is what is TOF. So TOF is a congenital heart condition involving four abnormalities occurring together. First is ventricular septal defect, pulmonary artery stenosis, overriding of aorta, ventricular hypertrophy, and their sign and symptom is bluish discoloration of the skin by blood flow, that is blood low in the oxygenated, that is called cyanosis, shortness of breath and rapid breathing, then loss of consciousness, clumping of the finger, abnormal rounding shape of the nail bud, poor weight gain, tiring easily during play, irritability, prolonged crying, heart murmur, then tell spell, a sudden development of deep blue skin, nail and lip after crying, feeding, having a bowel movement, and a kicking his or her leg upon and walking. So in this condition, the baby having tell spell, a bluish discoloration of the lips, nail bud and their skin. Then we can go to diagnostic evaluation. Chest x-ray. In chest x-ray we can easily see in boot shoe like structure, and then we can give blood test, oxygen level measurement means pulse oximetry, in echocardiography, electrocardiogram, then cardiac catheterization. In management we can give oxygen supplementation, morphino sulfate, then knee chest position of the baby, then we can give surgical intervention. In surgical intervention, some temporary or some palliative surgery we can put to the tetralogy of Fallot patient. So first is it was common in the past to do temporary surgery during infancy for the tetralogy of Fallot. This surgery improved blood flow to the lung. A complete repair of the fourth defect was done later in childhood. For temporary surgery, the surgeon placed a tube between a large artery patch of the aorta and the pulmonary artery. The tube is called a shunt. One end of shunt is the surgeon placed a tube between the large artery branching of the aorta and the pulmonary artery. The tube is called a shunt. One end of the shunt is sewn to the artery branching of the aorta. The other end is sewn to the pulmonary artery. This is the main surgical intervention of the heart in a tetralogy of Fallot. The shunt create an additional pathway for blood to travel to the lung to get oxygenated. The surgeon remove the shunt when the baby heart defect are fixed during the full repairment. So this is all about tetralogy of Fallot. Okay, thank you.